I think AI can really be used to help care for patients if it's used smartly. It's not going to replace the nurse, it's not going to replace the doctor, but it may be able to get some information that's not easily found and bring it for me to make a decision with the patient quickly. I'm Dr. Chris DeFlitch, Vice President and Chief Medical Information Officer at Penn State Health. It may take some of that administrative burden of creating the notes, make it easier for me to do so. And it may actually be able to, when we're working with different electronic health systems and electronic health records, to be able to find information in different areas that maybe help me make a decision for you. So I think what it does is it contextualizes data, kind of brings the data to me so that we can take care of each other better, right? So it's about how we take care of patients with the data that we're given. And if there's a lot of data in these medical records and I can't see it, it doesn't really help. But AI can pull that stuff out. You hear people talking about maybe AI is going to replace jobs. I don't think that's going to be the case. I think that the information and the technology in AI is going to allow us to provide better care. If there's automated activities that occur, repeated activities, I think technology, AI can do that a little bit better. But if you don't have the human in it, it can be totally wrong. Now think about a diagnosis, right? I always say healthcare is about people taking care of people. And if I can have technology that supports me better to take care of the patient, that's going to be a lot better. It's not going to replace what we do. It's not going to replace decision making. Heck, AI has been around in radiology for 10, 15 years now. People are using it to more quickly diagnose the potential risk of a stroke inside of an MRI or a CT scan. And what it does is it brings the information back up to the radiologist and to the neurologist and to the emergency physician to say, hey, take a look at this one first. That's where it's going to enhance the care as opposed to replacing it. There's so much data in healthcare. There's so much data in the literature. To be able to do that in the human brain is really, it's very difficult. That's where technology can help. Okay, we can't be reliant on that technology. We've got to have that human aspect of it. I mean, for people who use sort of the LLM models, right? You put in the prompts and it'll put something back out to you. If you ask the wrong question, put in the wrong prompt, it's going to give you the wrong answer. If you put in the right prompt, but you use a different database or a different LLM, it's going to give you the wrong answer. The combination of the question that you ask and the data that you use then portends a good answer. Put that in the human aspect of it, you're a different human than this other person and this other person. It's not the same context, it's not the same LLM, it's not the same prompt. We've got to figure out what's the best thing for you. Using that technology is helpful, but it's only additive to that patient-physician interaction. I think high data intensity areas are really ripe for refinement using technology, using AI. Think about the human genome, right? And you've got these trillions of combinations of code inside of your genome, and we're all built just a little bit differently. And think about all the pharmacy opportunities are, and then you combine them into something we call pharmacogenomics. So does this drug work specifically for this person? Now put that drug in combination with all the other drugs. The exponential growth in data is just crazy, right? But if we can use technology in the right way to match the right medication with the right patient in the right diagnosis, I think we're going to enhance it. It's a learning area. We've got to be able to and willing to think about things maybe a little bit differently in that space, but I think that's ripe for improvement. There's two parts of sort of research in a very generic area. One is, do you have the data that you need to understand the problem? And then you have a discovery or a newness to that for the research. So let's say it happens to be in drug discovery, right? Do you have the understanding of the drug? Do you have the understanding of the people who may be taking that medication, and how could it be applied? Well, with technology, you can expand that and simulate it extensively. You could take large patient population data and be able to take some of that information and put your consideration for drug use across a larger patient population, something that no human would be able to do here. Burnout in healthcare is real. I'm an emergency physician. I've been practicing for 29 years now, and I love it. I love taking care of patients. I use technology every minute of every day, and I think some of this ambient listening with document generative AI that you're seeing to help me generate notes is really helpful. It takes away that administrative burden of creating note. I care about taking care of my patient. I care about having that conversation. The byproduct is the note. It's important, and it's important to memorialize that note so you can go back to your primary care physician and have good information carry forward. But it's also about billing, and it's also about quality measures and all that stuff. The technology can help me do that. It takes that burden away from me. You know, frankly, electronic medical records and all the technologies come before this probably added to the administrative burden in the delivery of healthcare. It's probably improved some quality and safety areas, but there's a higher administrative burden. I think using technology to decrease that burden, to make us more efficient and effective and get back to people taking care of people is where we need to be. The question is, how do you trust the technology? I think it's a trust but verify kind of approach, where you have to have the right prompt or the right question to the right data, and then have the human refine that or understand it. So you have the humanity component to it. The other thing is, where is the data? Where is it saved? And where does it go? Because if I have some data here in Pennsylvania, let's say, we have some guardrails around that. Or if it's healthcare data in HIPAA, we have guardrails around that. But what happens if that engine is housed in a foreign country or in a location that's not so secure? Now all of a sudden you have people that are accessing or stealing that data that may be in a different location that you don't have control over. So, you know, I think it's contingent upon IT professionals, cybersecurity professionals to ensure that these technologies are within a protected environment. So, you know, the doctors can do the doctor thing and the research people can do the research thing, but the technologists can do the technology thing.